Welcome to Infection Prevention and Control. The objective of cleaning is to prevent or reduce the risk of transmission of infections between people through the application of a set of procedures for firstly cleaning and secondly disinfecting environmental surfaces. This two-tiered approach is designed to provide a high level of protection to all people. Standard and transmission-based precautions take into account the way infections are spread and the potential sources of infectious agents. Standard precautions are work practices designed to achieve a basic level of infection control. They are primarily designed to prevent and minimize the transmission of infections. Standard precautions assume everyone is potentially infected and should be treated accordingly. The adoption of these cleaning and hygiene practices is important to contain the spread of the coronavirus, the COVID-19, through the wider community. The basic measures in standard precautions include ensuring appropriate hand washing techniques. You should apply items of personal protective equipment such as gloves, gown, apron, mask according to your organization's procedures. Understand how to handle and dispose of waste. Understand your organization's procedures for environmental cleaning and hygiene of all public areas. You should understand cleaning and disinfection of cleaning equipment or using disposable cleaning cloths between cleaning tasks. Transmission-based precautions are additional precautions used in situations where standard precautions alone may not be enough to prevent infection. In other words, we implement a higher level of cleaning, normally followed by disinfection of all surfaces. Essentially, this type of cleaning involves decontaminating an entire room, including walls, curtains and blinds, and all fixtures and fittings. This generally only occurs in health or aged care facilities. Transmission-based precautions are applied where there is a suspected or confirmed cases of infectious diseases, such as infectious gastroenteritis, infectious respiratory diseases, the COVID-19, MRSA, or VRE. As we've already heard, common infections such as colds, the flu, gastro, and other serious infections can be spread or transmitted via contact, droplet, or airborne routes. It is important to protect yourself, other workers, and clients by practicing good personal hygiene and wearing the appropriate personal protective equipment for the task being performed. The most common way infections are spread is via the hands. Hand hygiene is therefore one of the most important and effective measures that can be undertaken to prevent the spread of infection. Wearing gloves does not replace the requirement for hand hygiene, since gloves can become contaminated with infections or harmful germs just as easily as hands. The term hand hygiene refers to the process of hand washing using soap and water, or decontamination using alcohol-based hand rubs. It is important to understand when or how to perform hand hygiene. You can pick up germs from objects such as doorknobs and stair railings and being touched by other people who don't wash their hands. Think about all the things you touch each day and how many people have touched them before you. Remember, your hands and clothes and body are full of germs. Each day you enter the work environment, you bring with you many germs that can be harmful to other people. Remember, wash your hands before you start work each day. Cough etiquette should be applied as a standard infection control precaution at all times. Covering sneezes and coughs limits infected persons from dispersing harmful germs into the air. You should cover your nose and mouth with a disposable tissue when coughing or sneezing. You should dispose of tissues in the nearest waste receptacle or bin after use. If there are no tissues available, cough or sneeze into the inner elbow rather than your hand. If you accidentally cough or sneeze into your hand, wash them and then use an alcohol hand rub as soon as possible. Remember, try to turn away from other people when you cough or sneeze. Personal protective equipment, or PPE, refers to a variety of protective clothing and items used alone or in combination to protect you from contact with harmful germs and chemicals. There are 3 types of PPE that you may need to use during the course of cleaning. They include gloves, safety glasses, masks and face shield, and gowns or aprons. The prolonged wearing of gloves can increase the risk of irritant contact dermatitis from sweat and moisture within the glove. Glove usage should therefore be limited to when there is a risk of contact with chemicals or harmful germs. For example, when cleaning the toilets in the bathrooms, or when cleaning and disinfecting common surfaces in public areas. If you wear gloves, you should follow best practice. You should perform hand hygiene before putting on gloves and after taking off gloves. Gloves should be removed immediately after the activity for which they were used. For example, don't walk around with gloves as there is a potential to spread harmful germs. Disposable gloves must be discarded after use and not washed and reused. Reusable gloves should be washed and stored dry in between use. Gloves should be replaced when they are showing signs of deterioration. When gloves are worn in combination with other PPE, they should be put on last. Generally speaking, gowns and aprons are not required for staff undertaking routine cleaning activities, with the exception of the following circumstances. Usage of certain chemicals where the SDS suggests the use of gowns or aprons to prevent chemical exposure to the user. Decontamination cleaning of an area where a known carrier of a dangerous virus, such as the COVID-19, may have contaminated surfaces. Or there is a risk of contamination with body fluids or blood. If a gown or an apron is required to be worn, then it should be fluid resistant and must be changed between cleaning tasks. Safety glasses, masks and face shield is generally not required for routine cleaning activities. However, it may be necessary when cleaning highly contaminated areas, handling concentrated chemicals, or cleaning environments that may require transmission-based precautions.